Smith. My name is Viri. I'm going to be your nurse for today. I'm going to go ahead and sanitize my hands. If I could have you confirm your last name and first name and date of birth for me.
Jackie Smith, October 9th, 1952.
Alrighty, perfect. You are the person I'm looking for. Okay, so Mrs. Smith, I'm pulling up the orders, and it looks like Dr. Sharp has ordered a wound care bandage change as well as a wound culture. So we will be doing that today. Before we start, I have to ask you a couple of questions. Is that okay?
Yes.
Okay. What is your pain at today?
It's at a 0.
Okay. Do you need to use the restroom? Do you need anything before we begin?
No, everything's good.
Alrighty, sounds good. I'm gonna go ahead and sanitize my hands and get my equipment ready. But do you agree to the procedure?
Yes.
Alrighty, I'm gonna go ahead and wash my hands and begin. Alrighty, once I have that done, I'm gonna go ahead and put on my PPE. Alrighty, I'm gonna go ahead and put on my mask. I'm gonna change out my glasses for some goggles. Then I'm gonna put on my gloves. Gonna bring my supplies over. Alrighty, Mrs. Smith, and I have my supplies all prepared. I'm just gonna go ahead and get all set up. Is that okay?
Yes.
Alrighty. Okay, I'm gonna raise you up. Alrighty, I'm only gonna uncover that wound you have.
Okay.
Okay, and it looks like it was changed 2 days ago. So I'm just gonna go ahead and remove that bandage, but I'm gonna get all set up here with a biohazard bag. And I'm gonna put this right between your legs, okay?
Okay.
Alrighty, I'm gonna put a chucks underneath before I take anything out. Okay, we'll go ahead and throw this away. Now I'm just gonna start unwrapping your wound so I'm able to do that wound change, okay?
Okay.
Alrighty, take that away. Okay, I am inspecting for the drainage of the wound and any exudate. It is clear, looks normal. I'm pulling it away from the patient, throwing that away. Inspecting as well on this one. The exudate looks good. Alrighty, and I'm taking this off. Okay, looks good. Alrighty, Mrs. Smith. Now I'm gonna perform. So before I do that, I'm just gonna go ahead and assess around the area for any temperature changes, edema, any tenting or any odor. And I don't notice anything unusual. So now I'm gonna go ahead and I'm gonna perform sterile gloving, okay? Just so we can get it clean.
Okay.
Okay. I'm gonna go ahead and take off my gloves. I'm gonna toss this, and I'm just gonna bring this closer for safety purposes, and I'll set that aside. Okay, I'm gonna go ahead and perform hand hygiene, and my sterile gloves are right here. Alrighty, I'm taking a look at my packaging. Everything still looks like it is working, it is intact, and it is not expired, and this is a new kit. I'm just gonna go ahead and set this right on top of you, Mrs. Smith, okay?
Okay.
I'm gonna go ahead and sanitize my hands. And I'm gonna open my new kit. I'm gonna go ahead and set these two sets of gloves aside. And then I'm gonna grab my gauze, my sterile field. Alrighty. Once I have that all settled, I'm just gonna go ahead and perform sterile gloving. I'm gonna go ahead and sanitize my hands one more time, making sure I don't turn my back against the field. Alrighty, Mrs. Smith, I'm just gonna set this little paper on you, and it's sterile, so I'm just gonna ask you not to touch it, okay?
Okay.
Alrighty, I'm gonna bring my hands over here, and I'm gonna take out the contents of my kit. Alrighty. Okay, now I'm gonna go ahead and just pour some sterile saline with the label facing my palm. I'm gonna go ahead and set this aside. Alrighty, Mrs. Smith, we're gonna begin. Are you doing okay?
Yes.
Okay, I'm gonna go ahead and I'm gonna grab my gauze. Okay, I'm gonna clean in one direction, dispose. I'm gonna grab this. In the other, dispose. I'm gonna go ahead and grab two more. exposed. Mrs. Smith, how are you doing?
Pretty good.
Okay, are you in any pain right now?
Maybe a 1.
Okay. We're almost halfway through.
Okay.
Now dispose. Alrighty, once that is clean, I'm gonna have one of my assistants come and drop some swabs and sterile wound culture into my field.
Hygiene.
Now these are all new sterile culture packaging as well as cotton swabs. Alrighty, so once that is done, I'm gonna go ahead and pick up the culture swab. I'm gonna pop the lid off, dispose of that. I'm gonna grab my wound culture. I'm just gonna go ahead and go from anaerobic to aerobic. Just gonna collect it, then I'm gonna go ahead and put it in. Then I'm gonna go ahead and set this aside. Alrighty, now I'm gonna measure the wound. Okay, so it looks like it is close to 10 by 6. So this is now dirty. I'm gonna go ahead and just set it right over here. I'm gonna grab a new swab and I'm just gonna go ahead and check for any tenting or tunneling, and then I'm gonna measure the deepest part of the wound. And it looks like that is in 1/2 inch. Go ahead and dispose of that, set that aside. Alrighty, Mrs. Smith. So I have cleaned the wound. Now that my hands have touched the clean wound, I'm just gonna go ahead and change my gloves one more time, and then we'll pack it. Is that okay?
Okay, sounds
Okay.
good.
I'm gonna go ahead and remove my gloves, throw them away, perform hand hygiene. Now I'm gonna open a new pack of gloves right on your abdomen, okay?
Okay.
Alrighty, Mrs. Smith, I'm just gonna go ahead and proceed, okay?
Okay.
I'm gonna grab some new gauze. I'm gonna put some extra right over here. Okay. I'm gonna go ahead and pack that. Alrighty, and I'm just packing it enough so it's not overfilling the borders, so then that can cause breakdown in skin. Then I'm gonna top it off with 2 more dry gauzes. I'm gonna go ahead and grab my roll. Well, before I do that, I'm gonna go ahead and grab my ABD pad. White strip up. And I'm gonna go ahead and do that. Alrighty, Mrs. Smith, how are you feeling?
Pretty good.
Okay, cool. Then I'm gonna have my assistant help me lift up her leg. Are you still, is your pain still at a 1, did you say?
No, now that you closed it, it's back to 0.
Okay, awesome. I'm gonna go ahead and do that. I'm gonna grab my tape. Go ahead and tape that. And then because my kit didn't come with a label, I'm just gonna use a piece of tape, and then I'll come back to fix that in just a second. And I'm gonna put my name, date, time, and date, and my initials. I'll put that right there. We go ahead and set this aside. And then once I have that done, just gonna go ahead and clean everything else. Remove the checks. I'm gonna go dispose of this in the proper receptacle. I'm gonna clean my field that has already been used. And set this over here. I'm gonna dispose of it in the proper receptacle, in the garbage. I'm just gonna go ahead and then have my patient be comfortable. And I'm gonna go ahead and remove my gloves. Perform hand hygiene, and then I'll just lower him. Just wanna make sure that the patient is safe before I continue on taking off my PPE. Then I'm gonna undo my gown. Go ahead and dispose of that. Wash my hands. Take off my goggles. Set that aside. Take off my mask. Dispose of that. Sanitize my hands. Alrighty, I'm gonna grab that wound culture again. I'm just gonna re-verify with you, Mrs. Smith, that this is you, and this is also your name and date of birth.
Yep, that's me.
Okay, awesome. I'm just gonna go ahead and send this off to the lab. And go ahead and lower the bedside table. You're lowered in bed. Here is your call light. And how is your pain right now?
It's at a 0.
Okay, sounds good. Well, I'm just gonna go send this off to the lab, and then I'm gonna go document. But you let me know if you need anything, okay?
Okay, thank you.
Yeah, and I would set this back, sanitize my hands, and then go document, send this off to the lab.